Hi everyone. We'll be presenting on Tanezumab for chronic pain. As a brief outline of what we're going to be going through, a quick introduction, a little review on OA, the history and development of the medication, the physiological response, the mechanism of action, some clinical applications, potential adverse effects, and physical therapy implications. All right, just to start, we're going to do a brief review on osteoarthritis. Osteoarthritis is a chronic degenerative joint disease. It's a breakdown of cartilage within that joint, and it could lead to pain, loss of joint function, and can be anywhere from asymptomatic to very debilitating. The pathophysiology, it's a combination of multiple factors, primarily mechanical stress and potential risk factors, which leads to the articular cartilage to erode. These erosions progress, and then eventually chondrocytes proliferate and form little clusters. And these chondrocyte clusters, they eventually transition to osteocytes, causing the subchondral bone to thicken. And these alterations, along with the pain and limitations that were mentioned earlier, can also lead to synovial inflammation and then soft tissue damage or irritation. Some common medications for osteoarthritis are NSAIDs, either oral, topical, or other ways of administering it. Other analgesics such as COX-2 inhibitors, acetaminophen, tramadol, capsaicin, and then there's also injections such as intraarticular steroids or hyaluronic acid. So Tanezumab has started in 2006, and it showed promise in phase 3 trials back in 2009. However, in 2010, the FDA put a hold on on these trials due to some adverse effects that were found. But in 2012, the FDA allowed them to resume their studies, and it granted it fast track designation for chronic pain treatment back in 2017. Eventually, the medication development was stopped in 2021, and it's currently classified as an investigational agent and is not available to the public. Okay, so there were two reported means of preparation for the drug. The most common one was done by subcutaneous injection, and based on the studies, dosages could range from 2.5 to 5, even up to 10, but most benefits were found in the 2.5 milligram and 5 milligram group. These injections were done every 8 weeks in the study, and it showed some benefits. The cost, it wasn't, it's as I mentioned earlier, it's not available to the public, but a cost analysis study was found that it would be a cost effective if priced at less than or equal to $400 per dosage. And the efficacy, so in phase 3 trials, significant improvement in pain and function were found. These changes were done on self-reported measures such as the WOMAC or the PGA for osteoarthritis. However, there were some adverse effects. These adverse effects were found primarily in the tanezumab group compared to the NSAID group.
All right, so moving on to the mechanism and physiological response of tanezumab. So before we discuss tanezumab's function, we need to talk about NGF. So what is NGF? It stands for neurotrophic growth factor, which is a cell signaling protein, and it's responsible for neural growth, differentiation, and survivability of sympathetic and sensory afferent neurons. So why is NGF important? It acts as a pain modulator, so it can amplify and attenuate pain signaling with its presence when it binds to two receptors at inflamed tissues. These receptors are TRKA, which stands for tropomyosin receptor kinase A, and P75. And once bound to these receptors, it creates a downstream of pain signaling surrounding the inflamed tissue. So increased NGF presence will mean increased pain perception. So the more NGF present, the more pain a patient will feel. So how does NGF impact chronic pain? NGF can shape neuroplasticity in peripheral nociceptors, which can lead to central sensitization. And this creates hypersensitivity to nociceptive stimuli due to the chronic presence of NGF. And in the case of OA, NGF concentrations can be elevated in arthritic joints for longer periods, though this isn't always the case. And what does tanezumab have to do with NGF? So tanezumab acts as a ligand neutralizer. It binds to NGF, prevents binding to TRKA and P75. And if NGF can bind, the pain signal's amplification decreases. So tanezumab can indirectly decrease central sensitization by neutralizing nociceptive signaling, normally done by NGF. So this can help decrease pain in OA and other chronic conditions such as low back pain. So in short, tanezumab binds to NGF, decreases NGF availability to bind, which leads to decreases in nociceptive pain signaling amplification, ultimately decreasing central sensitization in chronic conditions such as OA, which essentially leads to less pain. So this can lead to decreased pain perception, greater function in the joint since there's less pain, and the patient may be willing to perform movement tasks that put increased stress on their arthritic joints. But it's important that we remember that just because the patient doesn't feel the pain when after they take tanezumab doesn't mean the damage is gone. So we have to be careful in loading these patients after they take the medication.
Tanezumab has demonstrated clinical utility across several chronic pain conditions, with the strongest evidence in osteoarthritis and chronic low back pain. In OA of the knee and hip, evidence showcases significant reductions in pain and physical function limitation, measured by both the WOMAC index and patient global assessment, with effects comparable to naproxen. Similarly, in chronic low back patients, evidence showcased significant improvements in average lower back pain intensity and Roland-Morris Disability Questionnaire scores, again performing similar to naproxen. For cancer-related bone pain, data shows significant improvement up to 8 weeks, though the effect faded over time and opioid use remained the same between groups. In interstitial cystitis, evidence suggests meaningful pain reduction, particularly in patients with widespread nerve sensitization, such as something similar to central sensitization or CRPS. Now turning to adverse effects, overall treatment emergent adverse events were not significantly different from placebo. Common events included injection site reactions, peripheral edema, joint stiffness, and paresthesia. Abnormal peripheral sensation, which was primarily occurred as paresthesia and hypoesthesia, occurred more frequently with tanezumab, though without statistical significance, and resolved in most patients under 10 milligrams. The most clinical notable concern is joint safety events. Tanezumab at 5 milligrams dose showed a significant increase in them, most commonly rapidly progressive osteoarthritis type 1, or RPOA, characterized by significant joint space loss of 2 millimeters or more within 1 year. Less common but serious events also included osteonecrosis, subchondral insufficiency fractures, and pathologic fractures as well. Unfortunately, due to this specifically, tanezumab has often been overlooked because it has benefits similar to NSAIDs with potential for much higher risk, despite the low incidence rate of RPOA.
So why does tanezumab matter in physical therapy? So the main big thing is that pain is no longer going to be, a telling sign during rehab. Patients may feel like their whatever symptoms they're feeling are gone, and then this can, cause them to overload things too quickly, go too hard at the gym, do their exercises with too much weight, which actually puts a big risk on joint overload. And yeah, the main thing here is that the symptoms may not match the actual joint condition, which poses a big risk of our treatment. With that being said, though, there are benefits, of course, for rehabilitation. One main thing is, with the pain reduction, the patient is going to be much more willing to do some of their HEP requiring, strengthening that can sometimes be uncomfortable. We can focus more on the neuromuscular part of the training, joint stability, and we can incorporate more kind of techniques and barracks that they probably wouldn't be able to do with their intense pain when they're not on tanezumab. So yeah, the main thing here, the benefits, of course, there can be improved exercise tolerance and better participation. However, there are big risks. The big risks are, that the pain masking is can and has shown that it hides the ongoing joint destruction. This was very interesting in an article showing the phase 3 of the 2010 trial of tanezumab. The FDA denied it because of the rapid progressive osteoarthritis that a lot of the people showed to have when taking tanezumab. And this is because, like we kind of mentioned earlier, you're more willing to kind of push harder and do more work, but this is at the cost of kind of more progressive osteoarthritis and actually worsening your conditions. And because of this, the FDA actually rejected the approval of Tanezumab in 2021 due to safety concerns. So how should PT modify exercise prescription if a patient is on Tanezumab? The main thing is, since we can't just go off of pain alone, we have to monitor joint swelling, range of motion, strength, movement quality, which is really important, kind of assessing if their movements like function, if they look good. If they look like, the patient might be actually overloading it and it doesn't look like it's quality, then we should for sure stop it and, just make sure we're exercising gradually and monitoring for any load or intensity changes. And the controversy is, and when the FDA was reviewing Tanezumab as a potential drug for the United States, it in a meta-analysis, it showed that out of 12,000 patients, Tanezumab actually increased the risk of rapidly progressive OA 9 times compared to the placebo. And going even more off of that, joint replacement actually reached 7% with the patients taking Tanezumab, whereas the people taking the placebo was only 1.7%. And that is the end of our presentation. Thank you so much for listening.